My name is Dr. Wieschhaus. I'm the Program Director for the Family Medicine Residency. Our program here in Mishawaka, Indiana is a 999 program, taking 9 new first years every year. It's a tremendous program. We have been family medicine residency since the early 70s, one of the first in the state of Indiana. Our applicants and our residents who come here expect a broad training in family medicine, and that's what we hope to give. When our residents graduate from here, we want them to be able to go anywhere in the United States, actually anywhere in the world, and to be able to deliver the baby, to care for those that are dying, and all the needs in between. While the landscape of family medicine is changing nationally, we recognize that and give our residents that opportunity. The ACGME allows us to give 6 months of elective time, and we've had that maximum for as long as I can remember. We recognized years ago that the type of resident we attracted, because of the presence of our global health track, brought us an individual who was mission-based, was service-oriented, and that carries over into so many things during their training here in terms of the care they give the patients here locally, that we felt, how can the residents with other passions keep that candle lit during their 3 years of training here? And our efforts to provide a longitudinal experience outside of those core requirements for the high-performing residents, they've been able to do that. ACGME and the requirements, the duty hour expectations, the supervision expectations, we meet all of those, but somehow through the efforts of not only our residents but also the faculty and those volunteer attendings throughout the hospital have made it possible for residents to pursue those other options. In our Family Medicine Center, we're structured with 2 teams, and our residents will work with the same nurses for at least a year at a time, oftentimes for all 3 years. They'll have a panel of patients that will remain unchanged during their stay here. That connection, the knowledge of the nurses with their patients, the relationship that our residents have with not only our back office and the nursing staff there, but with our front office staff, has resulted in some tremendous patient satisfaction scores we've received over the years. As we assess, we self-evaluate how we're doing with our residents and also in terms of the patient care we give. I've truly appreciated over the past several years the collegiality of our residents. Our residents come here and they expect to work. First year of residency is hard. There will be many stories after you complete that, but I think those stories are told with a smile on your face. I tell the residents that there will be many times during your experience here you're going to feel our hands on your back. And sometimes those hands are going to be pushing you into areas that you're not so comfortable with, but sometimes our hands are going to be there holding you up and giving you the support you need. Our supervision, I think, is unequaled. We will be on campus. We have senior level residents in-house to give you the confidence that help is there, but we also give you the independence that you need to learn to take care of patients on your own.